My name is Elina Troshchenko, and I'm research advisor at the Global Research Program on Inequality, GRIP. GRIP is an interdisciplinary research program dedicated to globally collaborative research, exploring the multidimensional character of inequality. Today, GRIP has the honor and pleasure of hosting a webinar that deals with some of the most devastating consequences of the COVID-19 pandemic, namely rising inequalities and growing child poverty. As the pre-existing structural disparities around the world are exacerbated and more children are pushed into multidimensional poverty, there's an urgent need to address policies implemented to counteract these effects of the pandemic, as well as to look at the knowledge gaps on these topics. Therefore, GRIP, in cooperation with Tatiana Chubarova, Enrique Delamonica, Gabriele, Koehler, and Keetie Roelen, who are all editors of publications in series International Studies in Poverty Research, is organizing a webinar series on the issues of inequality, child poverty, and social protection. This is the second webinar in this series, and as the title of the webinar indicates, then today we will be talking about research and research agendas on such topics as inequality and child poverty in post-pandemic world. And to discuss these issues, we have brought together a panel of experts and practitioners. But before I give word to today's guests, I must give you some practical information. So firstly, just for your knowledge, the event will be recorded and posted on our website later on. And secondly, this webinar will have a Q&A session at the end. So if you have any questions you would like our panelists to address, please post them in a Q&A section. And now let me introduce the person who will guide us through today's discussion, Keetie Roelen. Keetie is a research fellow and co-director at the Center for Social Protection at the Institute of Development Studies in UK. She is a development economist by training, and her current research interests include the dynamics of child poverty, social protection, and the linkages between child protection and social protection. Keetie has worked with many international organizations such as UNICEF, FAO, and Concern Worldwide, performing research and policy advice work in Southeast Asia, Southern and Eastern Africa, and Central and Eastern Europe. Keetie, the floor is yours.
Thank you very much, Alina, for this introduction. And thank you to everybody for joining us for this webinar today. Like Alina mentioned, the second in a series with already a very great discussion last week, which was very much around child poverty and social protection and the policy moving forward. Today, we're going to focus on knowledge and research. We're going to talk about what are some of the knowledge gaps, what do we know, and what should a future research agenda look like. And I'm really happy we have a very rich panel today, joining us from all different parts of the world. And I'm going to ask each panelist a question to spark a conversation, first between the panelists and then towards the end in the last 15 minutes, also Q&A and discussion with you, the audience. And you can do that using the Q&A and the chat function. So the first question that we wanted to touch on was around what we already know. What is the evidence that we have that emerged during the COVID pandemic in terms of the impact on children and families, but also what kind of things are lacking in our information. And we're particularly interested in issues around exclusion, inequality, and marginalization, who were most hit and most affected. So without further ado, let me introduce the first panelist, which is Annie Namala from the Center for Social Equity and Inclusion in India. And Annie, I'd like to give the floor to you first. And if I could ask you to keep your answers relatively brief, so everybody has the chance to provide their input and we can have a nice back and forth between us.
Thank you, Keetie. And also very nice to be part of this conversation. Really like to appreciate CROP and the GRIP organizations in taking up the whole agenda of social exclusion, inequality, and related dimensions consistently. I've been part of the politics of inclusion report that you had done on various papers and been part of some conversations. So I think it's really good to have this focused engagement on issues of exclusion and inequality. If I am to look at the pandemic and its impact, particularly on vulnerable communities and children, I would say we do have quite a bit of evidence. Like if I were to look at just South Asia and India in particular, particularly after the first pandemic and even the second wave, we do have data to say how the pandemic and the lockdown has impacted unemployment, the increased level of unemployment. In India alone, we have something like 300 million unemployed that has come into the unemployment sector. We've also got data in terms of inequalities, the rise of inequalities. We've got data on children who are out of schools. We have South Asia's counted about 450 million children, out of which 320 are in India. We've seen an increase in malnutrition. So I think there is quite some level of evidence and reporting that has happened from the pandemic and the lockdown impact. Three things that really come to my mind as an impact in exacerbating the inequalities is, I was recently in a village talking to young adolescent girls, and out of 11 girls, 4 of them told me that they will not be joining class 9 when the school has reopened. The school has already reopened, they are not joining. And the reasons were multiple, like migrants who had returned home, families that had returned home from migration, the lack of accessing a new employment in the native place, and some level of ongoing illnesses and ill health in the family. That seems to be a common trend for a lot of people. Another dimension that they said is, since school education is not free at grade 9, they were constrained in reaching schools. So what I want to bring up is, even though we knew that there are multiple reasons of inequalities and barriers, the pandemic made it very evident that these work together and we need to really address them in a comprehensive manner. I think that became very, very evident. The second thing that became very evident in the pandemic and the lockdown is that we know that our social and systemic structures actually maintain inequalities, but the pandemic itself resulted in increasing the inequalities. Like, you would be shocked and surprised that 11 billionaires in India had increased wealth of $100 billion in 6 months of the pandemic. While the GDP contracted and 300 million workers lost employment, the listed companies raised their profits by about 20%. The online education was something which a large majority of poor children could not join. And so the pandemic, and then we had a lot of states that suspended labor legislations. So I think the pandemic and such disasters are also spaces where the state and administration use it, and then it becomes another mechanism for increased inequalities. And all this has an impact on children, whether it's their nutrition, protection. So we've seen child labor increase, early marriages increase. And another thing that we also saw is an additional stigmatization to marginalized communities as carriers of the COVID virus, and new communities that have fallen into marginalization. So I think the pandemic has shown us, a complex space where multiple references need to be brought together, multiple issues need to be stitched together to understand how marginalized communities are affected by the pandemic and the lockdown and administrative dimensions of the state. Maybe I'll just stop here, Keetie.
Thank you, Annie. Yes, some really good points there about the impacts on children and family, but also how the pandemic has compounded inequalities, intersecting inequalities, but also how it's pulled apart those at the bottom and those at the top end, often not by coincidence, but as a result of deliberate policy. So thank you very much for pointing that out. And I would like now to give the floor to our second panelist, who is Fadia Kiwan, who is from the St. Joseph University of Beirut and the Arab Women Organization. And she's going to give us a perspective from another region in the world, the Arab region. Fadia, over to you.
Thank you, Keetie. I'm sorry for having been late. This is not the first time I made the same error. I opened my webinar from another email address, so it doesn't open. So I had to come back to the USG email. I'm very sorry. I listened to part of Annie's presentation. As for the Arab world, I have to, because with my hat as Arab Women Organization, I want to focus on the absence of gender segregated data on the consequences of the pandemic. But let me say that the pandemic came to develop a state of alarming situation for millions of children, girls and boys, because of conflicts and armed conflicts and wars in the area. You know that in the last decade, many Arab countries entered in wars, and some of them didn't finish with these wars. And as a consequence of these wars, we had millions of children out of schools, of droppers. And as for girls, we had an increase in child marriage and an increase, of course, of violence, domestic violence, human trafficking, bullying, and all forms of violence that you can imagine. We could have it already because of displacement, forced displacement caused by wars and armed conflicts. Then the pandemic came to improve the situation of decrease of social protection of children. And we had, since that pandemic, an increase of the gap, an extension of the gap between states, between social classes, between men and women, and between among poor people. We had an increase in the rate of poor, very poor people, and among them, children are the most vulnerable category. In social sciences, it is one of our concerns. We have to release ourselves from the traditional industrial concept of social classes to address social groups. And we had earlier in the book on social politics of social inclusion, we had the occasion of addressing many forms of exclusion, including ethnic one, exclusion based on gender, on ethnicity, on race, etc. So now we have to embrace a situation where we have pre-industrial and not post-industrial at all. We have pre-industrial societies where children are very poor, especially in rural areas, but most of the population is a rural population in most Arab countries. If you accept the rental states of the Gulf area, we should not be misled by figures, because all other countries have poor people, an important rate of poor people. And why should I focus on this situation? Because we don't have figures, reliable figures on these facts. We have facts, but we don't have really reliable figures. I went to many reports from UNICEF, UNESCO, the World Labour Organization, to look at their last reports, including that of 2021, covering the period of post-COVID-19. Then I didn't have really reliable figures, and sometimes we had contradictory figures. And what is surprising is that in some situation we could have figures, but not segregated, gender segregated figures. This is a shame. And if we look at the sources of these figures, even the report of UNICEF in 2021 is built on 7,000 of telephone calls to families. It's a qualitative research. So you cannot consider that it is representative of the whole Arab world of 4 100 millions, 50. So we don't have figures. And we need really to raise questions by these discussions among researchers. We have to raise questions, because when we raise questions, it will lead researchers to try to find out what is going on with figures. We cannot talk about evidence-based knowledge if we don't have figures. And you know that in social sciences, it's not only to have a figure, we have to read it. And unfortunately, we are misled by figures that are compared between Switzerland and Yemen, between Yemen and Saudi Arabia. It's their neighbor, but they have a very different situation. So what I would suggest to do is that we compare the situation of a country, figures in a country, to its own figures few years ago, that we call the diachronic analysis. We compare the same society to itself 5 or 10 years before, 5 or 10 years after, to see what happened, what is moving, what's going wrong in a situation, instead of comparing societies to each others and to go overseas and have very misleading comparison. In social sciences, we need comparison, but we have to be very careful in using this technique in our analysis. So what I can say as an overview of the area, that we had an increase in poverty, an increase in women unemployment, an increase of domestic violence, an increase of violence in all its forms, an increase in human trafficking, an increase of droppers from school, an increase of child marriage, an increase of girls working at home instead of going to school. When we look at rates of girls and boys schooling, girls and boys school enrollment of girls and boys, we may be misled, because sometimes we have more droppers among boys than girls. But this is misleading, because girls do not go to school neither, but they go at home where they have domestic services to provide to the family instead of going to school. If not, they are married very early. In many countries, we have had in the last decade, we had many legislations, but we have to enforce the legislation. We have a law that restrict child marriage, but the people continue marrying their girls at her 12 years. So we have to enlighten the fact of having a frame, a legal frame or not, and what is being made by this frame. Is it applied or not, and why not? So social analysis should go in deep in case studies. It's very important to raise questions and to go to case studies, and to be careful in comparing and to adopting diachronic analysis instead of comparing cultural areas, different cultural areas. May I have time later on to explain more on that? Thank you very much.
Thank you very much, Fadia. There is a lot to say, and there's some very rich comments there about, once again, the impact on children, girls and women in terms of poverty, violence, child marriage, but also your points about the lack of data, disaggregated data, and the difficulties in comparing across contexts are very well taken, and I'm sure we can return to that. Our next panelist, yet from another part of the world, is Yisak Tafera from the University of Addis Ababa in Ethiopia. Yisak, you just dropped out 30 seconds ago, so I hope you're with us with a stable connection for now for your contribution. So let us know from your perspective, what are some of the things that we've learned from the data over the course of the last, say, year and a half, but also some of the things that we don't know.
Thank you very much, Keetie. So I think, well, my input will be based on our collaborative research being done. Can you hear me? Hello? Yeah, just on the Young Lives Rise Project, ODI, and we monitor poverty during the time of COVID, and also some work with UNICEF. So we learn a few things. We have to learn a lot, so that I will explain some of it. The first thing is the economic shocks that have been affecting Ethiopia or households. mainly rise in price of food items because of the restriction of movement or businesses, and also fall of income. For instance, from our COVID survey by Young Lives in 2020, we found that about 82% of the households in the study have been affected by rise in price of food items or fall of income. That's really affecting the families, including the children. The second issue is, I think, child poverty has been worsened. Either they have, those who have been very poor have been become more worse because of some resources have been limited, and new poor households are emerging, and thereby of also children also themselves. So it's affecting worsening.
It looks like Isak has just dropped off. Isak, you're back.
Sorry. Shall I off the video? I think that would be better if it's not working there. So in terms of children, there is a high disruption of schooling, as you know, and it affects them especially for the poor children and rural children, that they were not able to go on. But for children from urban areas and from rich families, they can learn or follow up their schooling online, but not for the poor and rural area. So that is where inequality is happening. Also, time use, as my previous colleagues said, timing has been affected. Girls more affected by time use. And for instance, for Young Lives, about 70% of girls were confined to domestic work as opposed to 36% of the boys. So it has there is early marriage of girls. Instead of staying at home, then they have to opt for marriage, which is also raised in other areas. So what we know is livelihood interruptions because of economic shocks, learning interruptions. In some areas, there is mental health problem because of stress coming from the illness or the news about the pandemics. So that's the basic ones. What evidence do we need? I think we need what is the depth and differential impact of pandemics on different parts of children, children from poor households, from rural areas, disability, and gender. We have to also know the long-term impact on children, that's the mental health, the dropout, and the learning outcomes. So how many are dropping out, who are they, what's the learning outcome different from urban, rural, those who have access to private schools. Early and delayed transition are there. The early formation is early marriage of girls before they finish school. That will affect their adulthood equality, gender equality. Delayed transition means those who drop out and come back to school have been delayed by some years. So what is the extent of that one? That we have to learn. Forward-looking agendas, I think what is the most affected by the pandemics, still, as I said, the poor, the disabled, the rural, and the girls, and gender is very, very important. Another issue, I think, is what we have to see for those who've been affected very much during the COVID, those from poor families or rural areas or the girls. What are the recovery programs being designed? Do we have anything that so that they catch up with others that we have to look at and have a depth study? Is the existing social protection really up to the task of addressing such pandemics that we can come at some point? So we have to discover or look at into depths of comprehensive social protections that are not focusing on emergency like the response for pandemic, but something that is very comprehensive so that it will be there for supporting needy children. For instance, school meals, if schools are closed, then the school meals have to continue in some their families or other ways. So it's very important to have a comprehensive social. We have healthcare system, but that was not covering that for such pandemics. So is there any quality for the future addressing, for instance, protective measures providing or masks or sanitation or vaccination that inequality will be prevailing. For instance, in urban areas, there is vaccination, but no more rural areas. So that should be looked at. That is very important to see. So I would like to see a comprehensive social protection, which really makes use of not only under normal circumstances, but also when there is a pandemic. Another methodological input that we have seen is so far, it has been phone survey, where we cannot see or really discover the lived experience of children on the ground. So what will be the methodological innovations that we have to look at if we are not able to go to students, those who are out of school, that were face-to-face interviews? That methodological innovation is very important, because during the phone surveys, you always look at very general issues than the lived experience, or sometimes looking at the ideas of the adults. So I think one input what we have to look into is the methodological approach that we have to adapt during the post-COVID. Thank you very much. Sorry for the interconnection.
Thank you, Yitzhak. No, we heard you just fine there, and some really great contributions again on the devastating impact of COVID, and a lot that we do know about this, but also gaps in our knowledge in terms of what it means for gender specific groups. And then pointing out something that Fadia also picked up on, is that so much of the information that we have in terms of the impact of the pandemic is based on phone surveys, which give us some idea of what's happened, but also lack maybe the depth that we would really need to understand the full effects. I'm now going to hand over to our last panelist on this, mostly focused on this first question about what do we know, what do we not know. We're moving to Switzerland, where Katja Huyo is with UNRIST. Katja, over to you.
Yeah, thank you very much, Keetie, and thanks also to GRIP for inviting me to be on this exciting panel, and very much enjoying the discussion already. So much has been said already from my co-speakers on what we know about the impact of the pandemic on inequality, and as everyone has emphasized, we all know that this pandemic has exacerbated and amplified and deepened the structural and overlapping inequalities that we had already seen before, and which were already at the top of the agenda. So I think that both social protection and inequality has been, that the fact that everyone is aware that we have to do something about it has been catalyzed really through this pandemic. And the colleagues have already said, that both the economic inequalities, income and wealth concentrations, poverty has increased, but also the horizontal, the group inequalities, and very much for those groups that were already suffering from multiple or cumulative disadvantages before, whether it's ethnic minority or rural women, whether it's children in remote areas or from ethnic minorities or with disabilities, or you name it, basically. So just as we heard a lot about regional and some national examples, just let me underpin a bit what the other said with some global data as well. And as we know that already before the pandemic, young people and children were more affected by poverty, but also by unemployment and lower wages compared to adult workers. So even before the pandemic, young people were 3 times more likely to be unemployed and twice as likely to live in extreme poverty compared to adult workers. And now that the pandemic hit, again, the unemployment effects, for example, on young workers were twice as bad as for adult workers. And in terms of what we know, also what I found interesting is how with what type of speed and innovation the research community has responded really to the challenge. So we have really a lot of very timely studies on the impact of COVID on different social groups. We have both country case studies, we have some global data, And I came across a study that was also very, very interesting and really reinforcing what we know, that those that are most disadvantaged by poverty, conservative gender norms, disability or refugee status were most affected also from a psycho-emotional point of view, because this is especially also important for young people who are in a very decisive point in their development and in creating their capabilities. For example, what do we know about the long-term, the short-term impacts of the crisis? And one clear fear or worry that we have is that a lot of the impacts will actually go beyond the short term. And even if we can reverse some of the immediate or the worst economic impacts, a lot of the emotional, psychological, and health impacts, and also the educational impacts, will actually remain. And there is some estimations, for example, from the World Bank, that around 10 million children will permanently drop out of education. And the second thing is, for young people, joining the labor markets in a crisis period really means a loss of income that stretches over the entire lifetime. The World Bank has estimated that loss as $10 trillion actually over the lifetime of young people. So there are a lot of long-term impacts, and of course there we are still unclear about how exactly they will play out. And so I just to wrap this up, to say we know a lot. We know who's vulnerable. We know about the gaps in social protection and services. We know about the problems of labor markets for young people. We know about educational disadvantages. However, what is a big uncertain factor is now that we don't exactly know how the pandemic will evolve and how the different political systems also will respond. And a final point, we also don't know how basically the international solidarity will play out, and what type of on what amounts of aid or transfers we can count, also in terms of the rollout of the vaccination program. So there are a lot of uncertainties. I think the general macro and international environment is still uncertain, which makes it difficult for research now to give very, very clear projections about the future.
Thank you very much, Katja, for reiterating that there is a lot of information, but also emphasizing that we have knowledge gaps, particularly in this fast-moving world with respect to the pandemic, and of course, everything else in terms of crises and conflicts, etc. I want to pick up on the point about what evidence we do need, and also how we are going to gather that evidence. There was a comment in the chat by Paul Spicker about the need to move away from qualitative evidence being somehow less of less quality, maybe, or less rigorous, and that it might be less robust than quantitative data. And Gabriele Koehler also echoed these views, saying that we do need qualitative information. And indeed, that was pointed out by Fadja as well, pointing out the importance of case studies, and by Isaac. And we also heard the panelists talk about areas in which we have too little information, and groups about which we have too few or too little data. So I would like to return to the panelists and ask you, in moving forward and say the next year or so, the next 2 years, how do we as a research community go about generating the evidence that we do need and filling the gaps that we have just identified to really gain a better understanding and also provide input into those policies? Some of you mentioned social protection, that are so important to buffer against the impact, but also move forwards. So maybe I will take it in reverse order this time. So that means, Katja, I will return to you first.
Thank you, Keetie. Yeah, these are very, very interesting questions, and also quite thought-provoking, of course, for researchers, because usually the point that I make is that we have a lot of evidence and we have a lot of research and we have so much analysis to underpin policy action or to help policymakers to base their actions and decisions, you know, with data and evidence. But there is a certain inequality also in the knowledge production, I would say, and decision makers tend to choose the type of evidence, you know, that really reinforces, you know, their worldviews or their choices or their interests. So it is often also a question of, you know, how does the right evidence get, you know, to the right actors and people. So often maybe it's not a question of, you know, we need more evidence, but we need maybe to really bring that evidence, you know, to the right audience, and to raise really the visibility of certain data and facts and analysis. So this is something we are strongly working on at UNRIST and trying to level a little bit the asymmetry, you know, of knowledge production and the inequalities in global knowledge production, and also between different disciplines, between different research methodologies. We had the discussion about the quantitative, the qualitative research, but also the Global South research community, that, you know, their case studies, their approaches get a higher visibility on global agendas. So definitely there is a lot to do. There is a lot to research, and no doubt about it. But we also need really to advocate for a plurality of research, of approaches, of methods, and level out a bit that inequality, which often, you know, leads or results in this mainstreaming of policy advice and of the evidence, you know, that is constantly put up, whereas, you know, other interesting insights, specifically case studies, our interviews, different methods are sidelined.
Thank you, Katja. So for pointing out that it's not just about generating more data and evidence, but also making sure that what is generated is visible to a range of audiences. Fadia, would you like to add to this?
Thank you, Keetie. I would start at the point left by right now. When we talk about researchers and the audience, I think we have a misunderstanding or a misperception on what would be the use of research. There is actually a real gap between researchers in the North and what you call the global South or researchers in the South. And I may say that there is no research in the South out of universities. In the North, you have a profession of researcher. It is respected, it's reliable and secured in the post-industrial societies. But in the South, there is no researcher profession. If you are a researcher, you are definitely at the university. You're not sure that you will make a research neither, because it's very weak to impose to professors to do research. So there is a real problem, and we need not an audience, Katja. We need an ownership. We need to bridge with the South. We need to bridge with the South and produce altogether evidence-based knowledge, not comparing really, but maybe working on the methodology in order to have the same language. When we speak about a vulnerable category, we should have the same indicators to be sure to have the same way to perceive the situations, but not to try to compare Sweden to Yemen or to Lebanon at the moment. But we need to bridge both with the South, with the academia, with the universities, with the very shy centers of research in the South. Most of them lack money, lack funds to work, and they don't have enough opportunities to disseminate that information. Once I produced a book at St. Joseph University with many prominent professors from many French universities that they were visiting us. We produced a very important research, and I published a book, a sort of acts, proceedings of the conference. I couldn't disseminate it, even through gifts to other universities and the network of Francophonie. I couldn't disseminate it even gratis on complimentary basis. It's not enough. We need to circulate our publications. I may produce anything. It may be something very, very important. It will not reach a high scale of dissemination. We need to bridge, if we want really the future, a stable future, a prosperous future for the whole humanity on this earth. We should bridge with the South, and we should bridge especially with the academia, and then we should help them to bridge with the policymakers. At the moment, policymakers do not base their decisions on evidence-based knowledge. They don't. But at the moment, we do have a rise of civil society. We have more and more graduates from universities in the South. So we have a potential, an important potential to build on, to bridge with, and to have a voice that can express what we can find in the research and reach by the media, by the intermediation of the media, even the social media, to reach the policymakers and to urge them to work and to take decisions in light of what you have produced. We have to bridge. We have to look for the ownership of the research in order to see societies making use of what we are producing. Unless we do so, we will be always working in saloon, in clubs of researchers, working in very uncomfortable situations. When we think of the mindset of people, we are always concerned. So we will not feel comfortable if we have wars and poor people and vulnerable categories in the South. We will not feel comfortable. We have the material comfort, but not the psychological, the moral one. So if we want it, we have to raise our hand and try to meet them, not in the middle. We have to go to them and to try to bridge with them all and work all together. It's not only an interdisciplinary approach, it is a multilateral network of work that we should work on in the coming future. Thank you.
Thank you, Fadia, for pointing out the need to break our silos and build bridges in many different directions. Yitzhak, you're back with us. We're going in reverse order. Would you like to say a little bit more about your thoughts on a future research agenda, and maybe these points as well about knowledge production and building bridges between policy and research?
Thank you sorry for the interruptions. Yes, it is worsening the child poverty. So it's very important first to make sure that what are the additional challenges that such pandemic are bringing or adding to child poverty at all. So that's the really specific additional issues that the challenges are coming. As we say, early marriage or school out and other things, which are the impact of the very limited response to such challenges because of the limited or fixed social protection, which is affecting them. That's very important to see, to find out. And also to see that such interruptions are making adulthood inequality by disrupting the transition from childhood into adulthood. So that such pandemics are making difficult the transition for which has been difficult for children from poor families, but still worsening. So the transition is being disrupted and affected, which makes inequality high or widening in the large. So pandemic is adding inequality at adulthood. the final thing is, I think it's very important also to, to promote a broader social protection that has never been, although we know that the social protection for children is very already limited, but we have to make sure that we have to strengthen that based on our evidence. And to generate the evidence that can help us to feed into the policy is having appropriate methodology and approach. The methodology has been really challenging in a sense that we are now becoming very far away from the children themselves because of the COVID. And we don't know really when will be very close. We are planning to have, for instance, projects to go on person to person very close in 2 months and marriage and dropouts. But we will see how it's affected. We will see how really they are, because I think the qualitative method will help us to understand the lived experience of the children, not as the impact of us household as a general. So we have to have a methodological innovation in a sense that we really understand what are the additional children are being globally. So the thematic area, I see few questions which are emerging from all countries are very common. Then it's good to identify these areas, thematic areas, then go to develop some methodologies and
Thank you, Yisak. You're breaking up a little bit, but I think some of your points are coming across quite clearly about the need for social protection and understanding how that can help families and of course children. And there's a question about this in the Q&A as well that we can pick up in a minute. And your point about needing to hear the voices of children is also well taken, and it's something that hasn't been easy at the time of COVID. I would like to return to Annie now, also with a special request from Gabriele, if you could reflect on how you have been using your field research and disseminating this, and particularly reaching out to policymakers.
Thank you, Keetie, Gabriela. I think what has helped us is to have a civil society campaign. So the research is linked to the campaign, and there is a national level campaign where practitioners and experts, academics and others come together to really review situations. And what we have done is also, like, there is a huge gap on, in addition to what Fadia talked about regarding gender, there's a huge gap of data on vulnerable communities. And in a country like India, and with such population and diversity, we need that community level data. So we've been promoting and supporting community level activists to generate community data and putting that up, comparing it with national data. So 2-3 dimensions is, since a lot of us are involved in civil society work, so the data that we produce is also something that we can use and advocate with our own local governments and the national government. And we've tried to create an interface between formal researchers and academics and civil society. And in moving forward, we've been demanding that, like the national data sets being very irregular and very limited in its scope, that there should be a mechanism of building linkages with civil society and other data at the community level. If we're really looking at SDGs and leave no one behind, we need this community data. So we've been working on how we can, give visibility, produce more community data, and compare it at the national level and provide that. So I think that's one dimension. The second dimension, like many of us know, we have a number of policies and programs the government puts it out, but the implementation and the budgetary allocations are very limited. And I think our studies need to connect the budgetary allocations and utilization with policies and provisions, particularly when it comes to social protection. And I also want to look back at the chapter that Gabriele and I had worked together on. That's, it cannot be a single line kind of social protection that we look at okay, for poverty or for education, but there is a complex set of interrelationship between all these barriers and challenges. So we really need to look at multi-level social protection that can help vulnerable communities and families to support their children to move forward, to support the families to move forward. So I think the future post-COVID needs to look at a complex, multi-level, interrelated set of social protection for children to be moving forward. Thank you.
Thank you, Annie, for sharing how you link up research with civil society and ensure that community level data is included, and also for reflecting on the need of a multi-level social protection and different responses to different needs for different groups, which I think is something that has come up a few times in the conversation. We now have time for Q&A, and a few questions have already come in. And for those in the audience who have questions, this is definitely the time to put them in the Q&A box so that we can ask the panelists for their thoughts. I'm going to move to a question from Fredrika Anderson, who says, some have argued that the pandemic has created a momentum for building back better. Do you see any openings for some completely new approaches to child poverty and inequality research? And if so, what would those be? So we've heard your thoughts about some of the things that are lacking, some of the things that we need to know more about. But I think this question is really about pushing the envelope a little bit further still and asking you if there's an entry point now for something more radical and to think outside of the box. And here I'm going to ask the panelists if they would just like to wave if they have a response to this question. Fadia.
Yes, thank you. Thank you. You know, we always are blamed, researchers are blamed because the policymakers usually say you don't estimate the cost and you don't show who would pay for what you are asking for. The pandemic showed us bluntly that there is a need of improving the systems of social protection. But what does it mean? In a liberal global world, what does it mean? It means that somebody should pay for that. Who should pay for that? At the moment, middle classes are paying, but very little. But if we need to improve systems of social protection, we should really have another social policy in countries. But where are the forces, the social forces that will be driving and leading these social policies? We need to review the tax systems, to review the perception of the state. You know, we should look at frontally at the issue of revisiting the withdrawal of the state. Now the state is coming back, or should come back, because what happened with COVID-19, before talking about post-COVID, while COVID-19 was going on, we were in need of a public initiative, because private initiatives could not confront the challenges of that situation, of the dramatic or catastrophic situation of that times. So we need the state to come back, but we need the state to come back through a social policy, and a social policy built on a fair tax systems that will not impose middle classes too much, but maybe impose other social classes to bridge all together and to come back to social solidarity. Today, while we were seeing, because of the dramatic situation of the movement of migrants in the last years, before the pandemic, we had this fear about the migration to the West by swimming or by going through Turkey, etc. And we have seen the return or the rise of nationalistic spirit here and there. So why don't we try to consolidate that with a social solidarity within each society? We need social solidarity now more than ever, and we have to revisit our conception of the state, not the welfare state to come back, but maybe something that could be in between, the state who is really out, the gendarme, the policeman, and the authoritarian regimes. We need something in between, but it has to be driven by social forces. Thank you.
Thank you, Fadia, for pushing us to reimagine the role of the state and really what society should look like in light of what's happened in the last 18 months. Annie, you have your hand up.
What I see is like the pandemic has not resulted in the state being more concerned or trying to look at ways to work, build forward better. We haven't seen that either at the global level in international relationship or at the national level. So in fact, in countries like India, we do see the pandemic becoming one more opportunity for, clamping down on civil society, for privatization of public goods. So we haven't really seen a state contributing towards a better future of communities. So I think to ignore the political nature of the state and what corporate and state linked together do, I think that would be really a big danger. And there I feel that, one way that we can really do is we need the voices of communities to be much more visible at the national level, connected globally together. So I would say that we need more and more to build the voices of vulnerable communities, the complexities of their life, give voices to those issues. And then I think hopefully we may have some change in the state, though we don't really see it happening in many, many places. I think it's really not a very, pleasant, very forward-looking space that we are currently in.
Thank you, Annie, for this reality check. And also for reminding us that, of course, research isn't apolitical. It's something that is very much part of what happens in politics and around us, and can drive social change as well. Katja, Katja, I think you have the final word from our panelists because we're running out of time. So over to you.
Thank you very much. Yeah, also my 5 cents on the challenge of building back better. I think actually it's very important always to reflect in which direction we want to go, and in what form a crisis can be an opportunity. And it's true that often the realities are different from the propositions and creativity and ideas that come up in civil society or in the academic community. But I think that there are some positive developments as well, and each crisis situation in that sense gives that opportunity. And at least what has become very clear is that some countries who have more developed social protection systems, for example, were a lot better able to respond to the crisis and to protect their populations. And when we talk about social protection, I would always like to also take the broader approach of talking also about, of course, the social services, but also, the labor market policies and how much of the workforce is actually protected. So much of the building back better would be really to create comprehensive social policy systems, which provide social protection, but also decent work, especially for youth, also education, of course, free education for children, but also expanded care services, et cetera, et cetera. So we have a lot of demands, but I think that the public support for these measures is so much greater now, because people are really aware that their lives depend on these interventions. Maybe another topic that basically we develop at UNRIST at the moment in order to build back better. I completely agree with Annie that this requires now a very strong input from communities and civil society. And at UNRIS, we frame this at the moment around a new discussion about an ecological social contract, a new eco-social contract. And we're trying to build a network and also to do some research on it, because we think if we want to address poverty and inequality, we really have to see it in a broader context of rebalancing and redefining social relations. So it's relations between state and citizens, between capital labor, between generations, between genders, etc. So there is a lot to discuss and to deliberate now, and then to come to new agreements, conclusions, compacts that also define rights and responsibilities. So we are also very keen now to use the forthcoming period actually to have dialogues and to incentivize a lot of discussions and deliberations where different groups can input and discuss about how they want to see and shape their future.
Thank you very much, Katja, for this final word, and quite a positive note to leave us on how research isn't just something that happens in an academic ivory tower, but should really bring communities, policymakers, civil society together. Thank you from my side to all the panelists. And I think on that note, I'm going to hand over to Alina for any final words.
Yes, thank you, Keetie. And on behalf of GRIP, I would like to thank you all for the insightful discussion. I think today we have identified important knowledge gaps that will help to guide future research in this important field, but also highlighted the already existing challenges in knowledge production processes, which are extremely important to address to promote inclusive and collaborative science. And also we have touched upon challenges of the existing political and economic systems that we live in. So special thanks to our distinguished panelists, Annie, Fadia, Isak, and Katja for joining us, and of course to Keetie for moderating this discussion. It was a true pleasure to hear your input and views on the subject, and I hope we can continue conversation on these topics also off the screen and contribute to the advancement of knowledge on child poverty, social protection, and inequality. So thank you all for joining us today, and also the audience, and please follow our group on social media and check our website for upcoming activities and join our future events. Thank you all and have a lovely rest of the day.
Thank you very much.
Thank you, Alina.
Thank you.
Thank
Thank
you.
you very much.
Thank you. Thank you. Goodbye.
Bye-bye. Bye.